Let's go over the answers to the warm-up. First question, what's the clinical use of clomiphene and how does it work?
Clomiphene is used for infertility, and it's an estrogen receptor antagonist in the hypothalamus that blocks normal feedback inhibition. This induces FSH secretion and stimulates follicles.
Next, what drugs inhibit prolactin secretion? These are the dopamine analogs like bromocriptine. And the last one, what are the signs and symptoms of anticholinergic activity? So you're dry as a bone, so you have decreased secretions and decreased salivation. You're hot as a hare, which is increased temperature. Red as a beet is peripheral vasodilation. Blind as a bat is mydriasis and cycloplegia. Mad as a hatter is agitation and delirium. And then bloated as a toad is constipation and urinary retention. Now let's move on to the lecture.
Hello, and welcome to our Step 1 video on Staphylococcus. Before we talk about Staphylococcus in particular, I want to go through this algorithm with you. This is a really good graphic that includes a lot of important information. Now, this is the gram-positive algorithm. Do you remember our discussion about gram staining? Some organisms stain very well with the crystal violet stain and retain that stain through the decolorization process. These organisms are called gram-positive. They stain bluish purple. So if you see a blue organism on an image, remember that that's a gram-positive organism. Now, what happens when you gram stain in the gram-negative organisms? Remember that they don't retain that crystal violet stain through that decolorization phase. These then get stained with a counter stain, and these organisms will look red or pink. So if you see an image of a pink bacteria, those are gram-negative. So I want you to look at this algorithm. Under the title gram-positive algorithm, you'll see the division between cocci, rods, and branching filaments. Cocci are spherical, rods are rod-shaped, and they're called bacilli. The branching filaments look a bit like fungus under a microscope because of the filaments. These different shapes are usually pretty easy to differentiate in the lab. Let's follow the cocci down that algorithm. Now, when we're talking about gram-positive cocci, we're usually talking about Staphylococcus or Streptococcus. So a good first step is to decide if this gram-positive coccus is strep or staph. One way to differentiate these two is by the organization of the bacteria underneath the microscope. So if the cocci stick together in clusters, you're usually dealing with a Staphylococcus. If the cocci are in pairs or in chains, then you're usually dealing with a strep species. This characteristic is very important, so I definitely want you to remember that clusters mean staph and pairs and chains mean strep. But bacterial appearances can be deceiving, so we can do other biochemical tests to differentiate them as well. We do this by looking for catalase. Let's talk about catalase. Catalase degrades hydrogen peroxide into oxygen and water. Hydrogen peroxide is itself toxic to bacteria, and hydrogen peroxide is used as a substrate for creation of the toxic hypochlorous acid through the action of myeloperoxidase. So degradation of the hydrogen peroxide supply by bacterial catalase can decrease the killing effect of the neutrophils and monocytes on those bacteria. I want to take a second to remind you about the link between catalase-producing organisms and chronic granulomatous disease. People with chronic granulomatous disease have NADPH oxidase deficiency. Phagocyte NADPH oxidase is used to reduce oxygen to reactive oxygen species, an early step in the formation of hydrogen peroxide and hypochlorous acid. If the host cell cannot form reactive oxygen species, then the small amount of hydrogen peroxide present in the environment will be easily broken down by catalase-positive organisms. This lack of phagocyte NADPH oxidase leaves these patients very susceptible to infections by catalase-producing organisms. Okay, so back to catalase. If you put a drop of hydrogen peroxide on staph, which has catalase, you're going to see the formation of gas bubbles. This is the oxygen. If you put the hydrogen peroxide on strep, you're going to see no reaction. This is because strep doesn't have catalase, and so it can't break down the hydrogen peroxide into oxygen and water. Okay, so what if you know that your gram-positive coccus is a Staphylococcus? You'll probably want to know whether the organism is a highly virulent Staph aureus or if it's one of the typically less virulent species of Staphylococcus. The coagulase test separates out Staph aureus from most other staph species. Staph aureus is coagulase positive And several other species like Staphylococcus epidermidis and Staphylococcus saprophyticus are coagulase negative. Now, coagulase production is not merely a way to differentiate the staph species, but it's an important virulence factor for the staph species that possess it. Coagulase allows bacteria to induce coagulation or blood clotting. It also allows bacterial binding to fibrin and fibrinogen, increasing binding to host tissues and decreasing phagocytosis. So the coagulase negative staph that I want you to remember are Staph epidermidis and Staph saprophyticus. As you can see in your algorithm, these can be differentiated by the novobiocin sensitivity test. Staph epidermidis is, not surprisingly, all over your skin, your epidermis. It frequently is a blood culture contaminant, but it can also cause infection on things like prosthetic heart valves and other implanted material. And Staph saprophyticus is a common cause of urinary tract infection. You can see that we've made it all the way down the staph pathway. I'm glad we did that because staph is super, super important. Now I want us to talk about strep. So let's review for a moment. Remember that we're talking about gram-positive organisms, and these are going to look blue or purple on gram stain. Now we're also talking about cocci or spherical organisms, but now we're going to talk about the catalase negative organisms. What are these going to look like? Well, instead of cocci in clusters like we see with staph, we're going to see cocci in chains. Sometimes this chain is just a chain of 2 cocci and it'll be called cocci in pairs. Other times it'll be longer chains. For the catalase negative bacteria, the microbiology lab will frequently provide a description of the bacteria's ability to hemolyze blood agar. If there is complete hemolysis of the blood agar, there will be a clear ring around the bacterial colony, and this is called beta hemolysis. 2 types of strep usually cause beta hemolysis, group A strep and group B strep. Group A strep, also known as strep pyogenes, causes strep throat. Group B strep, also known as strep agalactiae, can colonize the female genital tract and cause pneumonia and meningitis in newborns. So we test pregnant women for group B strep at the end of pregnancy. Now, if you get partial hemolysis, you'll see a little green circle around the colony, and this is called alpha hemolysis. I want you to think of 2 types of strep when you see alpha hemolysis. One is strep viridans and the other is strep pneumoniae. Now, viridans actually means green and refers to that green alpha hemolysis that you see in strep viridans. Strep viridans is a colonizer of the oral cavity and can cause infective endocarditis in patients that have poor dentition or after dental procedures. Strep pneumoniae can cause pneumonia and meningitis. It is certainly known to show up on tests, so be sure that you know about it. It's usually described as gram-positive diplococci. So if you see that description, think strep pneumoniae. Another differentiating characteristic, and one that we've talked about in previous lectures, is that strep pneumo has a capsule. So if you see a streptococcus with alpha hemolysis and a capsule, think strep pneumo. And if it has alpha hemolysis without a capsule, think strep viridans. And finally, there is gamma hemolysis, and this occurs when there's no hemolysis. So there's no little ring of any kind of discoloration around that bacterial colony, and this is typical of enterococcus. So a catalase negative gram-positive coccus without hemolysis on blood agar is likely enterococcus. Okay, looking at the middle division, we see the gram-positive rods or gram-positive bacilli. Look at the gram-positive rods that we've listed. First is Clostridium. Clostridium is anaerobic. So if you see an anaerobic gram-positive rod on your test, think Clostridium. Corynebacterium, Listeria, and Bacillus are all on that list as well. Remember that Listeria is linked to contaminated deli meat and it causes meningitis in the very young and the very old. And lastly, there's Mycobacterium. The place where they will mention mycobacteria is usually not in reference to a gram stain, though. It's usually in reference to acid-fast staining. They'll mention acid-fast bacilli on a sputum sample, and you should think of Mycobacterium tuberculosis. The last section on that algorithm are some gram-positive bacteria that are neither cocci nor rods. They're referred to as branching filaments. These have a similar appearance to some fungi. The 2 that you need to remember are Actinomyces and Nocardia. Actinomyces is an anaerobe and Nocardia is an aerobe. Okay, now I want you to look at your study guide. There's a blank algorithm for you. We've also provided a blank PDF of the algorithm on your video viewer so that you can print that out and practice. I want you to spend some time filling this out and reviewing it. It's not difficult, but it just requires a little bit of repetition. Now let's focus our attention on just one bacterium, Staph aureus. Staph aureus is a particularly virulent organism, a really, really nasty gram-positive coccus that causes a whole host of human illnesses. Staph aureus has been getting a lot of press in recent years because of its resistance profile. MRSA is a common household topic these days. MRSA, or methicillin-resistant Staph aureus, is a Staph aureus that's resistant to an anti-staphylococcal penicillin derivative called methicillin. When it's resistant to methicillin, it usually is resistant to other antibiotics as well, and that's why it's important. Anyway, this bacterium used to be more of a hospital-associated organism, but now there's a type that circulates in the community. It causes a lot of skin infections, including rapidly worsening skin abscesses that frequently require surgical debridement. But whether or not the Staph aureus is methicillin resistant, the organism has a lot of virulence factors, and it's a major cause of morbidity and mortality in humans. It's a cause of skin infections, pneumonia, endocarditis, bloodstream infections, bone and joint infections, among others. One thing that we mentioned in an earlier lecture is Staph aureus' ability to produce toxins. The toxin production is responsible for toxic shock syndrome and scalded skin syndrome, as well as gastroenteritis. Let's talk about the gastroenteritis that's associated with Staph aureus real quick, since it's a frequent topic on tests. Staph aureus can grow in prepared foods, especially ones with dairy or mayonnaise or eggs in it. Often the question will mention potato salad or mayonnaise by name. What happens is that the Staph aureus replicates and produces the enterotoxin while it's in the food. The symptoms of food poisoning result from ingestion of the preformed toxin that's already in the food. The hallmark of toxin ingestion is that vomiting occurs really rapidly after the ingestion of that contaminated food, and then it resolves pretty quickly too. So that's food poisoning from preformed toxins, and you should definitely think about Staph aureus. The other bacteria that may come to mind here is Bacillus cereus, which also causes vomiting within a few hours of ingesting and then resolves within 24 hours. The big difference is the food that they're associated with. If you see the words fried rice or reheated rice in the question, then they're going to be looking for Bacillus cereus, preformed toxin. If they mention mayonnaise or potato salad, the answer is Staph aureus, preformed toxin. Now, I want to mention one other virulence factor with Staph aureus. Staph aureus can make protein A, which can bind to human immunoglobulin. When it does so, it disrupts opsonization and phagocytosis, allowing increased survival of Staph aureus. That is one of many virulence factors of Staph aureus contributing to its success at causing human illness. So at this point, I would like to briefly mention some pigment-producing bacteria. Staph aureus happens to be one of them, so this just seems like a good place to fit that topic into our discussion. Staph aureus forms large golden colonies. That's the name aureus, which refers to this gold color. Remember that AU is the chemical symbol for gold, and Staph aureus has golden pigment. Actinomyces israelii is another pigmented bacterium. It causes yellow granules, also known as sulfur granules, that can exude from the infected site. These yellow granules are actually colonies of the pigmented bacteria surrounded by neutrophils. One way that some students remember this pigmented bacterium is that Israel has yellow sand. That reminds you of that granular exudate and the color of the granules. Another well-known and well-tested pigmented bacterium is Pseudomonas aeruginosa. It has a blue-green pigment. And one way to remember this fact is to remember that arugula is green. That's a decent mnemonic, but it may be more helpful to you, for you to remember that Pseudomonas is an organism that's associated with water and air. When you think of water and air, think of the colors blue and green. Pseudomonas loves moist environments, which is why it causes hot tub folliculitis and infections in burn patients. It's also found in sweaty sneakers, all these moist places. Lastly, remember that Serratia marcescens has a red pigment. You can think of a maraschino cherry for that one, or you can think of Mars, which is the red planet. Okay, now let's keep moving through the staphylococci. Specifically, let's talk about coagulase-negative staphylococci. First, let's mention Staph epidermidis. Staph epidermidis is a skin colonizer. It's all over your skin. It's supposed to be there, and it usually doesn't cause any problems. Where you see Staph epidermidis causing problems and when it gains access into the bloodstream and comes into contact with foreign material like prosthetic heart valves and central venous catheters and prosthetic joints. Staph epidermidis can cause biofilm and require removal of that prosthesis to actually achieve cure. And finally, let's talk about Staph saprophyticus. We've already briefly mentioned the disease that it's usually associated with. Do you remember that? That's right, it's UTIs. It's implicated in about 10 to 20% of UTIs in females, being most prevalent among young sexually active females. You probably won't hear much else about Staph saprophyticus except that UTI connection. And that completes our discussion of Staphylococcus. Now I want you to pause your video and work your way through those end of session questions. When you've finished, turn your video back on and we'll go through the end of session quiz questions together. All right, let's go through those answers to the end of session quiz. The first question, label the following gram-positive algorithm. Here's the chart, so pause your video if you need to and you can check your answers. Next question, what is the function of catalase? It degrades hydrogen peroxide into water and oxygen. Next, 1 hour after eating potato salad at a picnic, an entire family begins to vomit. After about 10 hours, they were better. What is the organism? This is Staph aureus. Remember that classic association with Staph aureus and prepared foods, especially ones with dairy, mayonnaise, or eggs in them. But you should also remember that Bacillus cereus is on that differential too, but it's usually associated with fried rice or reheated rice dishes. And the last question, what very common aerobic skin colonizer is responsible for many indwelling foreign device infections? The one I want you to remember is Staphylococcus epidermidis. And that's it for our video on Staphylococcus. I'll see you next time.